Hello, and blood, full blood count. In the investigation of blood, the simplest test is full blood count. A full blood count means measures the following in assembly of blood: the amount, the amount of hemoglobin, the number of the different cells, red blood cell, erythrocytes, with the blood cells, leukocytes, and platelets, thrombocytes. The volume of the cell. The erythrocyte sedimentation ready a measurement of how quickly red blood cell fell to the vomiton of a sample of blood. Anemia. Anemia is on the of the common commonest diseases of the blood. It may be due to bleeding, loss of blood, excessive destruction of red cells, low production, for example, because the diet is lacking of or deficient in iron. A medical student examining an elderly patient with a very long level of hemoglobin, and is discussing the case with a professor. What's the most likely diagnosis in the case? Student, most probable carcinoma of the bowel with chronic blood loss. Professor, last a guide that as a diagnosis. A student, well, where was what ain't changing in this bowel habit or last waned. And professor, what else would you include in the differential diagnosis of service anemia in a man of this age? Student, he may have leukemia of some sort or a planting anemia, but that's thirst. That is was the very unusual Another cause is iron deficiency of persistence to have an adequate diet. Professor, okay, no, there is another cause of anemia, which I think is more likely. Student, chronic bleeding ulcer. Professor, yes, what about pernicious anemia? Can you excluding that? Student, well, there is good news of the typical neurological symptoms like parathyroid, pernicious anemia. Jordi Pons, the medical student for Barcelona, has made some language notes in this textbook. Pernicious anemia is a condition in which there is atrophy of the gastric mucosa when we consequent failure of instruction after production and vitamin B malabsorption. The onset is incision with progressively increasing symptoms of anemia. Patients are sometimes said to have a lean yellow color owing to combination of pale and mild healthy causes. The excessive breakdown of hemoglobin because of ineffective red cell production in the bone marrow. A red donkey glycine in something patient present with symmetrical characteristics in the finger and stressed early loss of vibrations, chances, and progressive blackness and ectasis explain might be palpable. Okay, bonus. Sonicom is English name for bonus. English names: pulse, cranium, boy, mandible, spine, vertebral column, breastbone, externum, rib, costa, collarbone, clavicle, shoulder blade, scapula, pink bone, femur, Nican pataya, shin bone, tibia. Fractures. A fracture is a break in a bone. Some of the different types of fractures. Brain stick displaced means noted impacted open compact component. Treatment of fracture. When the fragment of broken bone held and joined together, the union may be promised or help pain be reducing the fracture, replacing the displaced after reductions excessive movement of the broken bone. This prevents the fixation header. External, for example, a splint or plaster of Paris cast, or internal, for example, a pin or a plate and a screw. A displaced fracture when if no reduction may result in melonia, incomplete or incorrect union. Shield hold, millstone. Shield hold is the period during when a person is a shield. It ends with puberty, the onset of sexual maturity. In fact, is another word for a young child. Infancy is the period from bring until about 5 years of age. The milestones in shield development and days at when they usually occur. Stephen B. 8 months. Reading B. Month. Common deficiency disease. Morbidly rubella, measles, rubella, Herman measles, varicella, she kept us. Infections, parotitis, mumps, pertussis, whooping cold, acute laryngotracheitis, probe, escarptania, scarlet fever, rheumatoid fever, the stainless black poliomyelitis, polio, coeliac disease. A medical student has made some language known will reading or textbook. Whaling disease is a disease of the small intestine caused by sensitivity to gluten. It can present of a good in infancy if appressed. After waning, after including diarrhea, malabsorptions, and failure to thrive. There may be signs of malnutrition, and there may be some abdominal distension. There is delayed growth and delayed growth, then leading to short stature in adulthood. The endocrine system is and the science and access to much of deficiency to leaflet of circulation hormones cause a wide range of medical conditions. For example, hyperthyroidism and hypothyroidism, where there is an excess of hormone on form of their treatment consists of giving the patients something which inhibits the production of the hormone, as in the use of carbimazole. To train hyperthyroidism, when an hormone is deficit, treatment may be replacement therapy, for example, injections of insulin in the treatment of the diabetes. Negation feedback system. 1. PRH. Therapy reactive hormone is secreted in the hypothalamus and trigger the production of the TSH, trigger stimulation hormone, in the pituitary. stimulate the receptor of the thyroid to increase synthesis of both T4, tyrosine, and T3. The and else rest stored hormone producing increased plasma levels of T4 and T3. T3 fed back on the pituitary. Um, perhaps the hypothalamus to inhibit excretion. Goiter. An enlarged therapy gland is called a goiter. The enlargement may be defaced, involving most the gland, or localized, limited to a particular area, as in solitary single nodule. The increased blood flow in deficits alarming, for example, in Graves' diseases. A letter of referral. Mr. Davis' doctor has referred her to an endocrinology. Their doctor, I would be grateful if your wolf hit your old woman will has lost kilos in wine in a speeding of 18 more than usual. The describes herself already at 3. The storm, the wind, loves what to this. With more recently, the has developed palpitation, diarrhea, and had intolerant. She has no sense that air have a tendency to shock. The A part of the eyelid, a brow, eyelash, iris, pupil. Examination of the age. Air is an straightforward textbook description of home to examination the age. Look for skin, strabius, doping of the upper lip, ptosis, or oscillation of the ace, nipagmus in limb, lag, tube, upper, edily most irregularly in state of smoothly when the patient is asked to look down. An example, the pupil, and note whether they are equal in size. They are regular in fossils, circular. Others are abnormally dilated, large, or confusing small. The red normal to link the accommodation focus on their objective. The gastrointestinal system. Examination of the abdomen. They use a strain from a test description of the examining the abdomen. Not if the abdomen is distended, be fluid or gas. The presence of fluid can be confirmed by the menstruation shifting to length, focus, or drop between the patient leans to supine. Plan of their area of percussion moves. Palpate reaction, feeling works, tenderness, time when torsion, contraction of the abdominal muscle. Warning might be due to tenderness of anxiety and can be reduced if the patient is persuaded to relax, reheated, over is contact and is due to peritoneal irritation. The face. They are several words for face. Doctor somaticize. There was blood in the stall. Have you passed blood stall? Bowel movement is using the reference to this defecation. Have your bowel moved today? Have you had a bowel movement today? Have you noticed a change of bowel habit? How often do you open your bowel? Change if in bowel habit cold the conditions are infrequent storm of reaction. Friends soap or leaking stock. Normal stock are brown color and semi-solid or formed the consistent or degrade or of carnage and substance can be shown and is on a collie. Necology. The family reproductive system. 1. Fallopian tube, vagina, over ovary, neck of lung. Menstruation. A period is the common name or for menstrual monthly period. The amount of menstruation is known menarche. The last menstruation period is commonly abbreviated in doctor notes MEMP to 15 to 6 of men's. The last menstrual period was to Westwood. The menstrual cycle or length or frequency of periods is usually winter in the front or the where have windmills lasting 4 days and occurs every. If period lasts more than 4 or 5 days, it can be described as prolonged. The transitory period means exception clock plus monotony often pays the plus occurring flow. The trans period point means the monarchial or painful menstruation. A gynecology consult. A gynecology consult. A tell woman. Gynecology. Are you period regular? Yes. Patient, yes. What often do you get in every form when? When? What where you went you started to get in about when was your last period? When I go. All those period last usually for uh, for 4 or 5 days. Do you get close? Link. Do you have period pains? Not really. Is there any discharge when the period? A little. What color is it? With contraception. For women, the main method to prevent pregnancy, including the oral contraception pill, known as the pill, the diagram, and the intrauterine dip. Or copper hold condoms are evaluable for both men and women. The hair are circulation one. Short, shortness or brain. Shortness of brain or okay. Shortness of hair brain. Shortness of brain or range racialness is the response at freeing this causing the exertion, physical activity, so and cleaving stairs. But in several cases, it might present even at rest. Patient, a patient one is breathless when linked flat orthopathy. For example, in bed, when sent to sleep raised up to or more pillow. The abbreviation COBOEA. Station from shortness, brain, or exercise, or on exertion, or on effort. Patients say, I get terrible short breath, clamping stripe. Dr. can ask, wall money pillow do you sleep on? Harry win. The normal resist heart rate is best per minute in 3 tests is my love best per minute. In treatment and clay activity, the heart rate gets good as in. The heart beat might be regular or irregular. In an irregular thing, I think me there might the be early bands when irregular in premature bands. Hair failure. Hair failure could occur when the hair is unable to maintain sufficient cardiac flow. The amount of blood movement be the heart each minute. For the body neck, it might involve the less city of the hair, the ring city, or both. In less hair failure, the main symptom is illness, restlessness. These symptoms of ring heart failure including periplay or the aorta, pulmonary artery, pulmonary veins, male veins, septum, tricuspid valve.